Jeremy Leslie here with a demonstration video of how to use the workflow pages from admission to discharge to care for a patient. In this example, imagine that you are a hospitalist. You've just received a call from the ED physician reporting they have a 40-ish-year-old male with a history of COPD who's on oxygen at home, who's been diagnosed with pneumonia and has worsening hypoxia in bed 19. When you open the patient's chart and go to the Admit Manage Workflow page, you may review any of the components in any order you wish. For this example, we will start with the Documents component. We will click here to review the ED physician's notes, which notes a 43-year-old male with a history of COPD requiring frequent hospitalizations who continues to smoke and was diagnosed with influenza 1 week ago and given Tamiflu, and today developed a fever to 103. Patient was given Aduoneb, Levaquin, and Solumedrol in the ER, was diagnosed with pneumonia. The next component we review, vital signs, shows that the temperature was 103.2. You may question whether this patient was given Tylenol upon visualizing that result. If we click on the order profile to the medication section, we see that no Tylenol was given. We can now go to the new order entry and place an order for Tylenol. Returning to review the vital signs, we note that the patient was hypoxic to 80% on 2 liters. We can then review the diagnostic films. Clicking on the chest x-ray shows a right lower lobe infiltrate concern for pneumonia. We can select and tag this information for use later. Reviewing the lab components, we note that the patient has a creatinine of 1.8. Upon looking back, we notice that the patient's previous creatinine was less than 0.6, suggesting this is an acute kidney injury. We can add that as a diagnosis by going to the problem list, add to this visit, AKI, and return back to the laboratory section to review the rest of the laboratory results. We can now review the home medications, which show albuterol, amlodipine, Flovent, Lasix, and metformin. We can also review the problem list, showing that the patient is being admitted for pneumonia with acute kidney injury and COPD exacerbation, and has a history of diabetes, COPD, and hypertension. At this point in time, we would go to the patient's room and perform a history and physical. This would then be documented on the right side of the screen here. We recommend using Dragon dictation for the subjective and HPI. Now that we've completed a subjective HPI, we can hit Save and go to the review of systems. We recommend either using Dragon to dictate a review of systems or using the .ros dropdown to document the review of systems. Similarly, you can either use a Dragon command or the .pe dropdown to document a physical exam. And then hit Save. At this point in time, we would place the admission orders by going to New Order Entry to the Med-Surg Admission Power Plan and the Pneumonia Power Plan. In the Pneumonia Power Plan, we would note that the patient does have risk factors for Pseudomonas and start them on Levaquin and Zosyn. We would then complete the orders in the Med-Surg Admission Power Plan, including the resuscitation status order, and provide some IV fluids to see if this will improve the renal function. Given the history of diabetes, use the glucose management. For VT prophylaxis, use the VT Power Plan and Lovenox, and get another BMP in the morning. We can now note that we still have an alert for an admission diagnosis that's required. If we go to the problem list, we can modify the pneumonia diagnosis to an admitting diagnosis, which will then resolve the alert. We are now ready to create the admission H&P by clicking the hyperlink here. The H&P will pull in the chief complaint the primary care provider, the HPI documented on the workflow page, the review of systems, and the physical exam, as well as the past medical history, procedure history, home medications, allergies, social history, family history, and immunizations. In addition, it pulls in the most recent vital signs, as well as the maximum and minimum over the past 24 hours, and the current oxygen settings. It also includes all of the labs done since arrival for this encounter. It includes the code status and a spot for additional documentation. In the area that has diagnostics results, we can take the tag text from the chest x-ray and include it. We would then go to the assessment and plan, which includes the diagnosis documented in the problems component as this visit. It also includes all the orders that were placed by this provider for admission and shows the current VTE prophylaxis. At this point in time, we can make edits to the assessment and plan. For example, when you are done, select Sign Submit. This completes the workflow for day 1 and this video.